All right, so once we have our patient set up, impedance is checked, we are now going to make sure everything in the computer is ready to run. So we've got our oVEMP protocol selected, 97 dB, which is the intensity we use for this protocol. And for her, she's got her right ear plugged in currently, so we're going to select right. Once we're ready to go, we will hit start. It gives us a message here saying that the stimuli level is really high. It's at 80, higher than 80 dB in HL. Do you want to continue? Yes, we want to continue testing. And so now it populates here on the right side. When we're looking at an oVEMP, you're looking at really early latencies. So we're looking anywhere in the range of, you want your N1 to be around 10 milliseconds and your P1 to be around 13 milliseconds. So we can change our epoch here across the bottom so that we can see that a little bit better. And I tend to run a very few amount of sweeps. And so what we're going to do when we have this, we're also going to have her look up. And so I'll tell her, go ahead, look up, and she's looking up very high. This pulls the inferior oblique muscle up towards the electrode so that we can get a better recording of this response. And then after about between 60 to 100 sweeps, I'll tell her to go ahead and relax. And then she can relax, she can close her eyes, she can stare forward, whatever's easier for her. So let's run a couple more. This is a very small response. Go ahead, look up. And so a lot of times we do have to run several of these to find one or two really good ones. So she's looking up here. Relax. Look up. And the other thing to tell them is to make sure that they keep their head flat and don't lift their head up too much and really do more with just their eyes. So we want them to look up with their eyes only, keeping their head flat. And again, 60 to 100 sweeps, and we will relax. Okay, we've got a couple of decent ones here. Let's run one more, see if we can get one more good one. So go ahead and look up. And it only gives you that error message for the high intensity on that first go around. Afterwards, you're good to run every single time. And relax. Okay, so now what we're going to do, I'm going to switch ears. So we're going to plug the other ear up. I only plug one ear up at a time because I want them to be able to hear the directions that I give them for the testing. Keep in mind, a lot of our patients, especially if they're older, they do have hearing loss, and so we want to make sure that they can hear. The other thing to note is if they do have hearing aids, you can swap hearing aids at this point. So you can have one hearing aid in one ear while you have the insert in the other, and then you can swap when it's time to switch ears. So over here, I'm going to click 97 dB, and I'm going to click left so that we can switch sides, and we will go ahead and start. Go ahead, look up. And relax. Look up. You'll see the sweeps over here if you haven't noticed yet. Over here off to the left, you'll see how many are recorded and how many are rejected. And so we're kind of watching this to see our number of sweeps here. And relax. All right, we've got a couple of very good oVEMP responses here. These are much prettier than the other side, and so you can see the difference. And so we'll talk about that in the next video as we do our analysis, but that will be the end of this video.